welcome to the Thursday, April 9th edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracy Smith and I am here with our hospital's incident manager, Dr. Stu Kennedy. Dr. Kennedy, people in our hospital, coming into our hospital, might have noticed different questions as part of the screening process. Can you explain that?
Certainly, Tracy. A few things. I'll just remind the group again. We have had no new hospital admissions for COVID-19, so we still have 3, and both are still stable, okay? And our presumptive cases have gone down to 15.
That's good news. So, sorry, you just said we had 3 in the hospital and both are stable. Is that both or all 3?
All 3 are stable.
Great.
Sorry.
Okay.
Thank you, Tracy. And we have 15 presumptive cases. That is on a downward. The other ones from yesterday, we had 18 to 15 were negative. So I think we're all doing a pretty good job right now, and the hospital certainly is doing its job in preparing for more COVID-19 patients. But as far as your question regarding the criteria, we've expanded our criteria. Prior to this, it was based on travel outside of Northwestern Ontario and outside of Canada and international travel. But those travel restrictions have been lifted except for Northwestern Ontario because the 2-week period is up for most people. Most people have now got the message and not traveling to the States. Some are still coming back from their trips in Florida and the rest of the United States, but travel is not as a major criteria now. Symptoms is our major criteria because we know we've had some evidence that it's in the community, not widespread at all, but certainly now we're basing all our sort of criteria now on symptoms where you have 2 or more symptoms, and that includes fever, GI symptoms like nausea and vomiting. It includes chest pain. It includes shortness of breath. It includes a headache and fatigue. Very broad symptoms. So we expect our number of swabs in the assessment center to really go up at a rapid pace. And we're also giving priority to our healthcare workers, to our workers in long-term care, to our staff to our police, our fire department, our first responders, because if they have any symptoms at all, we really want to get on it and get them isolated, but also get them back to work as soon as possible for the workforce. So you'll see the screening has enhanced, and also for our healthcare workers here at Thunder Bay Regional Hospital, if they have any of those symptoms, they don't necessarily have to be swabbed, but they certainly can't come in the hospital and work. So we're still protecting the environment, both our workers as well as our patients, to prevent COVID coming into our hospital and spreading.
So with this change in criteria, it means that more people qualify for testing. Do we have capacity for all of that extra testing?
Well, of all the uncertainty and anxiety I've been going through the past little while, this is my top priority and sometimes totally out of our control. So let me give you an example right now, which is concerning myself. We now have the technology, 2 pieces of equipment can do the COVID-19 swabs and getting us a positive or negative. We have that in-house. We are ready to go. But we need the testing material and the reagents for both these technologies that we have. If we had the reagents and the test kits, we could do close to 400 swabs in-house a day. But these kits are being somewhat delayed at the federal level because they have been unable to give us a license for these reagents for one of our technologies called BioFire. I certainly am concerned about that. And the other one called the CEFTID test kits, we have ordered 1,000 of these kits that would allow us to do 10,000 in-house, but because of the worldwide demand, or at least a Canadian demand, we don't know when they're coming. So we're ready to go. Mr. Ford announces he wants to do 13,000 a day in Ontario. Well, I would like to do a lot more here in Thunder Bay, but we need those test kits. The impact of not having in-house testing We're getting the swabs back in 2 to 3 days now, which is good, but it impacts patient care. It impacts the safety of our healthcare workers. Much better to know whether you're being exposed to a positive case versus a negative case. And we need to take the largest steps we can at every level to make sure we secure the safety of our staff, as well as the safety of our patients, and as well as the safety of the patients in this community.
So you're working very hard to acquire the equipment, acquire the supplies, and we're at the stage now where you're relying a little bit more on our healthcare partners and our political friends to provide support.
The equipment's here, we just need the testing kits.
Okay, well, keep up the good work. So let's talk about concerns in the community outside of COVID-19. You are a family physician. You're in touch every day with other physicians. Are there any concerns for the health of our community outside of infection through COVID-19?
Absolutely. When people are suspected to have COVID-19, we're unable to do the full medical workup. We're unable to do particular testing because of the exposure to COVID-19 and also the contamination of the equipment and technology we have. So every single day we certainly have struggles to really give normal day-to-day care to our high-risk population. So from my perspective, we need to begin a recovery phase. We've been so overwhelmed with COVID-19, and we still are, and we're going to be overwhelmed for weeks to months. But we can't put the rest of the population at risk. There's surgery that's being put on hold. There's medical assessments that are being put on hold. There's certain cancer treatments that may be put on hold if they're not priority. We owe to the population to begin to look at a recovery phase. So what are the next steps that we have to move forward with to actually get Thunder Regional Hospital, get our healthcare providers on the next step of recovery when this pandemic it's not going to be over. It will be over, but coronavirus is always going to be here in the community, but we need to move things forward, or the backlog of medical care, the backlog of surgery is going to be overwhelming. So we, for the IMS structure, are beginning sort of a committee called the Recovery Committee to put things in place and how we begin to step things up when the time is right.
Okay, so that must be a very difficult balance because we're still very focused on keeping COVID-19 out of the hospital, limiting access to the hospital, but balancing that with the needs of the community so that they don't become acute.
If we don't do more for the community members, we'll have farther greater death rate from ignoring many of the needed health needs than COVID-19.
Okay, wow, that's another big chapter. We'll talk more about that in future episodes. For now, we know that this weekend is a holiday weekend. People might be very tempted to get together with family members, so this ties in with community again. What would your advice be to community members, on this Easter weekend?
Well, don't eat too much chocolate.
Is there too much chocolate?
Never too much chocolate. But I think it's working in Thunder Bay. You know, we haven't had the significant increased numbers of COVID-19 identified. Certainly our hospitalization rates are low for COVID-19 patients. So it's working. It's working because the community members are doing safe practices. They're doing their social distancing. But we need to continue to do that. And Easter weekend's a big weekend for all of us, no matter what religious domination you're with. And we need to actually prevent those large family gatherings. We need to still stay at home. And we need to really be prudent about making sure that all those initiatives are working so well, continue to work. This is going to be not a sprint. It's going to be a long-distance sort of walk, and certainly it's working so far, and we need to continue these initiatives so we prevent the spread of COVID-19 in this community, in this region. And we can do it. And I think we're ahead of most communities in Ontario, if not Canada, because we've acted so aggressively and so quickly.
So don't let your defenses down this Easter weekend. Find creative ways to stay connected with family and friends through technology. There are many options, but please don't visit, don't hold those family dinners, stay at home, practice physical distancing. Bit of a controversial edition today. I'm sure we'll have a lot of viewership.
You will get only transparency and honesty from our COVID-19 incident management team.
I know that many people in the community thank you for that. Thank you,
Thank
and
you.
we'll see you again tomorrow.
Thank you.